Site and color of lens. Site patellar fossa BW anterior and posterior segment. Color, transparent. Shape of lens. Biconvex. Radius of curvature of anterior and posterior half of lens. Anterior 10 mm flatter. Posterior 6 mm. Diameter of lens at equator. 10 mm. Blood and nerve supply of lens. No blood or nerve supply. Refractory power of lens. 16D far, 19D near, variable due to accommodation. Refractory index of lens. Center 1.4, peripheral 1.3. What's Weigert ligament? Circular attachments of lens and anterior vitreous. What's Berger space? Retrolental cavity, central to Weigert ligament. What's Cloquet canal? Potential space during embryogenesis, contains hyaloid artery. Disappear by 8 months of gestation. Remnant of Cloquet canal. 1. On posterior lens, Mittendorf dots. 2. On optic disc Bergmeister papillae. What's space between preequatorial and postequatorial zonules? Canal of Hanover. What's space between postequatorial zonules and hyaloid zonules? Canal of Petit. Layers of lens. 1. Capsule. 2. Anterior epithelium. 3. Cortex. 4. Nucleus. Adult, infantile, fetal, embryonic. Which layers of lens form lens fiber? Cortex and nucleus. Types of cell in anterior epithelium of lens. A cells present anteriorly. E cells, present at equator. Lens capsule is thickest and thinnest at. Thickest, posterior pre-equatorial zone. Thinnest, posterior pole. Which structure in eye has max refractory index? Lens at center 1.4. Lens capsule is made of which type collagen? Type 4. Time of formation of embryonic nucleus. Day 27 of fertilization. Time of formation of fetal nucleus. During implantation. Time of formation of infantile nucleus. Immediately after birth. Time of formation of adult nucleus. 1 month after birth. Primary and secondary lens fiber in nucleus. Primary, embryonic nucleus. Secondary, rest all parts of nucleus. Shape and interdigitations of anterior lens sutures. Y-shaped, apical process. Shape and interdigitations of posterior lens sutures. Inverted Y, basal process. Lens protein released from the capsule during surgery is called sequestered antigen. Ascorbic acid transport in lens epithelial is through SVCT2, sodium-dependent Vit-C transporter. Water-soluble proteins in lens. 1. Crystallins, alpha, beta, gamma crystallins. 2. High molecular WT proteins, HM1, HM2. Water-insoluble proteins in lens. 1. Vimentin phylincin, urea-soluble. 2. MIP26 aka aquaporin 0, urea-insoluble. 3. HM3, HM4. Which protein is found in max amount in lens? Beta crystalline. Which protein are most important in lens and why? Alpha crystalline, cause they are heat shock proteins and prevent denaturations of other proteins. Which lens proteins are increased in cataract? HM3, HM4. Which lens protein maintain transparency of lens by maintaining hydration? Aquaporin 0 or MIP26. Antioxidants in lens. Vit-C, E, glutathione reductase, superoxide dismutase, catalase, vitreous. Which amino acid deficiency can cause cataract in eye, and by what mechanism? Tryptophan deficiency. Due to this levels of antioxidants and kynurenine in eye are dropped. Causes cataract. Tryptophan levels does not affect levels of which particular antioxidant in eye? Superoxide dismutase. From where does lens gets glucose? Lens gets 90% glucose from aqueous humor and 10% through vitreous by simple and facilitated diffusion. Glucose metabolism in lens happens through 80% by anaerobic glycolysis, 15% by Krebs cycle and Hum shunt, 5% by sorbitol pathway. How does diabetes and galactosemia affect glucose metabolism in lens? They inhibits anaerobic glycolysis. Which pathway for glucose metabolism is used in lens during hyperglycemia? Sorbitol pathway. Glucose is converted to sorbitol fructose. How does sorbitol pathway in lens can cause cataract? Cause sorbitol fructose cannot diffuse out of lens, they increase osmotic pressure and hence lets the fluid into lens causing hazy lens cataract. Sorbitol and fructose are converted into one another through which enzyme? Aldose reductase.